Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. A reminder that this is for press only. Please change your Zoom login name to include your full name and your media affiliation. You can do that by mousing over the word "more" in the participants list and then selecting rename. And we will start off our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everyone. As we continue to grapple with COVID-19 and the financial impact it has had on so many, I want to take a few moments to talk about a way thousands of Philadelphians can get more money in their pockets. There is cash literally waiting for thousands of residents who may not be aware of it, but the clock is ticking. According to the Internal Revenue Service, roughly 64,000 eligible Philadelphia households have not yet received their federal stimulus payments, approved as part of the CARES Act passed back in March. That represents an estimated $77 million sitting in the U.S. Treasury that could help Philadelphians with low incomes. While most eligible Philadelphians automatically receive these economic impact payments, some did not receive checks because they need to provide additional information to claim their payments. Most are households that do not usually file a tax return because they have little or no income. The good news is there's still time. Eligible Philadelphians who have not yet received their payment can submit their information by November 21st. Again, the deadline to do this is November 21st. So we need to get the word out because there is less than 2 weeks left. The payments are up to $1,200 for individuals, $2,400 for married couples, up to $500 for each qualifying child. For a married family of four, that would be a maximum of $3,400. That is money that could help families buy groceries, pay their bills, or reduce their debt. Ensuring that every eligible resident receives this money is important, not just for the recipients, but for the entire city. For assistance completing a non-filer tool, residents can call 1-855-FINPHIL. That's 1-855-FINPHIL. And now Dr. Farley will give you his update.
Thank you very much, Mayor. I'm afraid I don't have good news today. Our case counts are hitting all-time highs here in Philadelphia, as they are in the rest of the United States. There's no question we are in a dangerous period in the coronavirus epidemic. Here are the numbers. Since this time yesterday, we have identified 879 new cases of the coronavirus infection in Philadelphia residents by the standard PCR test, bringing us to a total of 49,775 people with this infection since the beginning of the epidemic. Now, for the past week that ended last Saturday, November 7th, we averaged 515 cases per day. These are case counts that are higher than at any time in the epidemic, higher than our peak in mid-April. Partly that's due to the fact that we're doing much more testing than we were doing before. Last week, we averaged more than 5,500 tests per day, but also in part it's because the percent of people tested that is positive is increasing. Last week, we had 9.3% of people test positive so far, and we know if there's some late ones that will come in, so that number will likely rise in the future. That's the highest percent positive that we've had since the middle of May, and that percent positive has increased about fourfold since late September. That's what's happening in Philadelphia around us. Very similar things are happening. In the United States as a whole, they're all-time high daily case counts. Likewise, in Pennsylvania, they're all-time high. In the United States as a whole, there are more than 120,000 cases per day that are being reported. Now, back here in Philadelphia, just a couple of words on what's happening with testing. As I just mentioned, we have hit now our long-term goal to increase testing to more than 5,000 people per day. So we'll continue to try to make testing more available, but clearly it's a sign that testing is much more available than it was before. Now, their next step is to make the testing more rapid so people can get the answer more quickly, and so that hopefully will prevent the spread to others. We are gradually making more rapid testing available. Among the things we're doing is that the Avid rapid test cards, these are cards that don't require a machine, have been purchased by the federal government. They're being shipped to Philadelphia. They're supposed to be arriving here this week. We'll be distributing those to testing sites that can handle those cards. You do need to have a special waiver from the government in order to do that test. The first sites that will be using the cards are federally qualified health centers and some urgent care centers, but more sites are likely to follow after that. We'll also be giving guidance to physicians about how they can do rapid testing, including with these test cards in their office. So I hope increasingly in the future, people can go to their regular physician for rapid testing for the coronavirus. I should say the rapid testing is not just these cards, that there are other machines as well that can provide that testing. Now, a word or two about hospitals here in Philadelphia. With the increase in case counts, we're seeing more people being hospitalized. The state's database on hospitals is now reporting that there are 386 patients currently hospitalized with COVID in the city of Philadelphia. That number is increasing fairly rapidly. We hit a low of 90 in late September. As of October 25th, we were 196. So that means we've doubled in the past 2 weeks. So we are increasingly concerned that hospitals may come under strain if this rate of increase continues. Now, what about deaths? Since yesterday, we've identified 12 new deaths from the coronavirus infection in Philadelphia residents, bringing us to a total of 1,901 since the beginning of the epidemic. Now, we know that there's always a delay in us receiving reports of deaths, but since October 18th, we're running about 15 deaths per week. That's an increase of about 10 deaths per week from that we were doing in September. And we do expect to see more increases. There are a number of groups that are doing mathematical models to project what's going to happen with this epidemic wave, and they're predicting that we're going to see an increase in deaths that will be on a similar order of magnitude that we saw in the spring wave. So what do we know about where and how the virus is spreading now in Philadelphia? It is still spreading within households. It is still spreading with people who visit from one household to another, particularly relatives that visit from one household to another. It's spreading in small social gatherings, including those gatherings related to sports, those gatherings among college students. It's spreading in various forms of celebrations, in weddings, in funerals, bridal showers, birthday parties. We're hearing a lot about birthday parties recently, and every other type of celebration. It's spreading at football game watch parties. A number of sites around the region, not necessarily the city, have reported cases associated with hockey tournaments and the social activities that go on around these tournaments. We're also seeing evidence from our contact tracing of it being spread in office-type workplaces, as well as in restaurants. We're now hearing about spread in restaurants from our contact tracing interviews. For example, a group of people going to restaurants for birthday parties. Now let me talk about schools for a minute. There are many cases that have occurred in schools that are open for in-person instruction in Philadelphia now, which are the parochial schools, the charter schools, and a number of independent schools. Bring about a number of cases in individual schools. So far, though, we still only have 3 schools where information has suggested that spread occurred within the school. And that's out of about 95 schools that are doing the in-school teaching right now. Then just a word or two about what happened last week with the election and its relationship to potential spread of coronavirus here. We know that there were a number of people who were celebrating or otherwise gathering around the election time, outdoors and perhaps indoors as well. And we do worry about the spread of this infection whenever people gather for any reason. So we are making a recommendation that if people were in a crowd as part of that period, whether that crowd was indoors or outdoors, even if you're wearing a mask, if you're in a crowd of people where people are fewer than 6 feet apart, you should stay away from others for 14 days for the quarantine period and get tested at 7 days after you had that exposure, because there definitely is a risk that you were exposed to the virus in that gathering. Now, let me talk a little bit about some good news that came out this week. The Pfizer company has reported that their vaccine has been more than 90% effective in protecting people who didn't already have antibodies from infection with the coronavirus. Now, this information came out in a press release. It was not a scientific study, but if that press release is borne out by a published study, this is very exciting news for a couple of reasons. First is this vaccine itself, which may be then very, very effective for people. But also, if this vaccine works, we would expect that the other vaccines to work also. And here's why. The Pfizer vaccine is a very narrowly targeted vaccine. It produces antibodies only to what is called the spike protein of the virus. This is the part of the virus that allows the virus to attach to human cells. So that's an important target for a virus, but we didn't know for a vaccine, but we didn't know for sure that that would be enough in order to be protective. The other vaccines that are being developed often produce antibodies to the spike protein and other parts of the virus. So if the spike protein antibodies by themselves protect people, then this other vaccines should be protective as well. So when will that vaccine will be available to us? Well, we're being told that the first doses may arrive around the end of this year, around the end of December. We don't know that for sure, but that may be around that time. It means we hope to be vaccinating in the first months of 2021. Now, we don't have information from the companies or from the federal government about how quickly these companies can scale up production of these vaccines. So it may be several months before the vaccine is available to everyone here in Philadelphia. And unfortunately, much of the current surge of the virus in Philadelphia will happen before the vaccine arrives. So our overall message today is that the risk is increasing now with the colder weather, the drier air, and people being indoors more with a change in season. But the virus appears to be following the same pattern of other respiratory viruses like influenza that rise throughout the fall and then peak in January or February. So behavior that was once safe is now dangerous. Things you could get away with a couple of months ago, you can't get away with now. You're much more likely to get infected. With that, we anticipate further rapid increases of this infection here in the city of Philadelphia. There's no question, this is a dangerous period. This is possibly the worst period of the epidemic. Now, our first case was diagnosed just 8 months ago today, back on March 10th of 2020. So we know this has been a tough 8 months for everyone in this epidemic. And I know that everyone is tired of this virus. Unfortunately, the virus is not tired of us. So we all need to step up our safety precautions now just a little bit longer until the vaccine arrives to protect us. So we in the city are considering restrictions on activities to prevent more spread. We don't have any restrictions to announce today, but we want everyone to be prepared in case we have to put those restrictions in place. More important though, because the spread is mainly happening in private settings, our success depends mostly on what Philadelphia residents do on their own. So let me reiterate again what people should do. First, work from home if at all possible. Don't go to the workplace. Stay away from others unless it's necessary. Don't have a get-together after soccer practice. Don't join friends to watch football games on TV. Don't go to brunch. Don't go to birthday parties. Stay at home as much as you can. Now, if you have to go out, say to exercise, and we would support that, stay away from others. But wear a mask when you're around anyone who's not a household member. You should first assume that anyone you come in contact with has the infection. Just assume that. And if they aren't wearing masks, ask them to. And then assume that you may have the infection and don't know it, and so wear your mask to protect others. Then I want to remind people that the holidays are coming up. We're recommending that people celebrate the holidays only with members of their immediate household. These are the people that you're already exposed to every day. Extended family gatherings right now are very dangerous. Don't have extended family gatherings over the holidays. And then let me just talk again about masks. People need to be wearing masks when they're around anyone outside their household, and they need to be wearing masks correctly over their nose and mouth. We have a big gap between those people who are wearing masks at all and people who are wearing them correctly. A mask doesn't do any good down by your neck. A mask does much less good if it's covering your mouth but not your nose. We know that people are going to stores and other businesses in Philadelphia not wearing masks. So we're asking business owners to tell their customers that they must wear a mask. Mask wearing in Philadelphia in public right now is mandatory. And if you are not wearing a mask right now, you are putting yourself and others and your community at risk. Now, we know the next couple of months are going to be very difficult. What we're trying to do now is simply to stave off the infections and reduce the number of deaths until the vaccine becomes available. We know this is very difficult, but if we do act now, we can save lives over the next few months. Thanks very much.
All right, thank you, Dr. Farley. And in light of the situation that Dr. Farley described with regard to COVID, we are joined today by Dr. William Hyatt, the Superintendent of the Philadelphia School District. Dr. Hyatt.
Thanks, Mike, and good afternoon, everyone. And as you are aware, the School District of Philadelphia has been diligently working to transition to a hybrid learning plan, a plan we believe was important for us to continue delivering uninterrupted, high-quality instruction to our students. As with everything we've done over the last 8 months, we have to be flexible, doing whatever was necessary to adapt to the quickly changing COVID-19 conditions. As Dr. Farley just shared, our city and surrounding counties are seeing spikes in cases, and there is a concern that those numbers will only rise in the coming weeks as people gather for holidays, the weather gets colder, and the air gets drier. In order to help safeguard the health and well-being of our staff, our students, and our school communities, and after consultation with the Philadelphia Department of Public Health, the Pennsylvania Department of Education, and the Pennsylvania Department of Health, we have decided to remain 100% virtual at this time. This means that our plan to begin transitioning to a hybrid learning model on November 30th is on hold, and all students will continue to engage in digital learning until further notice. Transitioning to hybrid learning and having students engage in face-to-face instruction with teachers is our goal, but our top priority is the health and well-being of our students and our staff. Therefore, our transition to hybrid learning will take place only when guidance and data from the Philadelphia Department of Public Health, PDE, and the Pennsylvania Department of Health indicates that we can safely do so. We received a great amount of feedback supporting that transition to hybrid learning, and this decision to remain 100% virtual is disappointing news for many families and many students. For those families who did want to resume in-person learning, their selection to choose hybrid learning will be honored when it is deemed safe for us to make that transition. As we continue with 100% digital learning, we will remain fully committed to supporting the needs of our students and families. This means we'll continue to offer tech support and Chromebooks to those students who may still need devices to engage in digital learning. We also want to remind all families who still do not have access to reliable internet service that they can get free service through the PHL Connected initiative. They can call 211 to get information on how they can get those resources to successfully engage in digital learning. The 211 hotline is open 7 days a week, 24 hours a day, and it's available in 150 languages. The district will also continue to provide meals to those students who need them, offering 5 breakfast and lunch meals each week at schools throughout the city. Families can visit philasd.org to find the closest meal distribution site near their home. And we will continue to offer the social and emotional supports designed to help our students and their families during these unprecedented times through our Healing Together initiative. Additionally, we will continue to use this time to focus on building preparedness, making sure that schools are ready to receive students and staff again when it is deemed safe to do so. So I thank you for your time, and at this time, I'll turn things back over to Mayor Kinney.
Thank you, Dr. Hyatt. We're going to go first to Armando, who will have the Spanish language translations of the mayor's, Dr. Farley's, and Dr. Haight's remarks.
Palabras del alcalde Jim Kenney para el 10 de noviembre del 2020. Buenas tardes. Mientras continuamos lidiando con la pandemia del COVID-19 y el impacto financiero que ha tenido en tantos hogares, quiero hablarles sobre una forma en la que miles de habitantes de Filadelfia pueden tener más dinero en sus bolsillos. Literalmente, hay dinero en efectivo esperando a miles de residentes, pero el tiempo pasa rápidamente. Según el Servicio de Rentas Internas, mejor conocido como el IRS, aproximadamente hay 64,000 hogares elegibles en Filadelfia que aún no han recibido sus pagos o cheques de estímulo federal aprobados en marzo como parte del proyecto de la ley CARES. Esto representa un estimado de $77 millones del Tesoro de los Estados Unidos que podrían ayudar a los habitantes de Filadelfia con bajos ingresos. Si bien la mayoría de los residentes de Filadelfia que reúnen los requisitos ya recibieron automáticamente estos pagos por impacto económico, algunos no recibieron estos fondos porque necesitan proporcionar información adicional para reclamar sus pagos. La mayoría son hogares que generalmente no presentan una declaración de impuestos porque tienen pocos o no registran ningún recurso. La buena noticia es que todavía hay tiempo. Los residentes de Filadelfia elegibles que aún no hayan recibido su pago pueden enviar su información antes del 21 de noviembre. Una vez más, la fecha límite para enviar su solicitud es el 21 de noviembre, por lo que tenemos que hacer correr la voz, ya que quedan menos de 2 semanas. Los pagos son de hasta $1,200 para individuos o $2,400 para parejas casadas y hasta $500 por cada hijo que califique. Por ejemplo, una familia de 4 personas con 2 adultos y 2 niños podría recibir un máximo de $3,400. Y este dinero podría ayudar a su familia a comprar alimentos, a pagar sus facturas vencidas o a reducir sus deudas. Asegurarnos que todos los residentes elegibles reciban este dinero es importante no solo para los beneficiarios, sino para toda la ciudad. Para obtener ayuda para completar la solicitud a través de la herramienta para contribuyentes no declarantes, los residentes elegibles pueden llamar al 1-855-FINPHIL, es decir, el 1-855-FINPHIL. Y esta es la actualización en materia de salud para el día 10 de noviembre del año 2020. El conteo de casos está llegando a niveles muy altos. Este es un periodo muy peligroso en todo el territorio de los Estados Unidos. Comenzamos con los números en Filadelfia. La semana pasada, del 1 al 7 de noviembre, el promedio fue de 515 casos diarios y hoy reportamos 879 casos confirmados con pruebas PCR, con un total de 49.775 casos. El conteo de casos ahora es más alto que durante el pico de la epidemia en el mes de abril. Esto es en parte porque estamos haciendo más pruebas. Alrededor de 5.500 pruebas diarias en promedio se realizaron la semana pasada, pero el porcentaje de casos positivos también está aumentando. La semana pasada, el 9,3% de las pruebas resultaron positivas. Este es el porcentaje de positividad más alto desde mediados del mes de mayo, aproximadamente a 4 puntos por encima de lo que tuvimos a finales del mes de septiembre. En el resto del país se ha llegado al número más alto de casos reportados en Pensilvania y el país entero desde el inicio de la pandemia. Los Estados Unidos ahora reportan más de 120.000 casos diarios. Con respecto a las pruebas, alcanzamos la meta de realizar más de 5.000 pruebas diarias. Ahora tenemos la necesidad de hacer las pruebas más rápidamente. Gradualmente estamos habilitando más opciones de pruebas rápidas. Las tarjetas de prueba de los laboratorios Avid llegarán esta semana. Las distribuiremos en los centros de pruebas que puedan manejar estas tarjetas. Los centros de salud calificados a nivel federal y los centros de urgencia tendrán la primera prioridad. Con respecto a los hospitales, en el aumento de casos hay más personas hospitalizadas. De acuerdo a la base estatal de datos, actualmente hay 386 pacientes hospitalizados con el COVID en Filadelfia. Este número va en aumento. El mínimo han sido 90 personas hospitalizadas a finales de septiembre. Hubo 196 personas hospitalizadas al día 25 de octubre y esta cifra se ha duplicado en las últimas 2 semanas. Con respecto a las muertes, lamentablemente se identificaron 12 fallecimientos por el COVID-19 con un total de 1.901 muertes. Hay un retraso en la recepción de los informes. En la semana del 18 de octubre, el promedio de fallecimientos fue de 15 por semana. Esto significa un aumento de 10 muertes por semana en comparación con el mes de septiembre. Esperamos también que este número, lamentablemente, siga aumentando. Las proyecciones de los grupos nacionales indican que el aumento de las muertes será similar a la ola del COVID-19 que tuvimos durante la primavera. ¿Dónde y cómo se propaga el virus? En los hogares, en las visitas entre los hogares que tienen los familiares, en pequeñas reuniones sociales, incluidas las relacionadas con el deporte y las universidades, en las bodas, funerales, despedidas de solteros, fiestas de cumpleaños y otras celebraciones, al ver partidos de fútbol americano con los amigos, en los torneos de hockey, en los lugares de trabajo tipo oficina, en los restaurantes, y hemos obtenido esta respuesta tras las entrevistas de rastreo de los contagios. El tema de las escuelas es bastante complejo también. Hay muchos casos reportados en los estudiantes o en el personal escolar. Hasta el momento, la información proveniente de 3 escuelas indica que la propagación fue en esas instalaciones. Es importante aclarar que solo 3 escuelas de más de 95 que están dando clases en persona presentaron casos de COVID de esta manera. Con respecto a las celebraciones y las manifestaciones después de las elecciones, estamos preocupados sobre una potencial propagación del virus. Si usted estuvo en una manifestación, incluso usando una máscara, por favor, manténgase lejos de otras personas y realícese una prueba del COVID 7 días después de la exposición. En cuanto a las vacunas, el informe de la vacuna de Pfizer indica que esta tiene más del 90% de eficacia. Y estas son noticias emocionantes para nosotros. Si esta vacuna funciona, es probable que otras también funcionen. La vacuna de Pfizer reduce los anticuerpos a solo la proteína de pico que tiene el virus del COVID-19. Esto es, lo que hace que el virus se utilice para adherirse a las células humanas. Hay otras vacunas que producen anticuerpos contra la proteína de pico y otras partes que componen este virus. ¿Llegarán las primeras dosis para fin de año? Eso está aún por determinarse. De ser así, estaremos vacunando en los primeros meses del 2021. No tengo aún información sobre la ampliación de la producción y distribución de estas vacunas, así que pudieran pasar varios meses antes de que estén disponibles para todos. Desafortunadamente, gran parte del aumento de casos actual ocurrirá antes que nos llegue la vacuna. El mensaje en general por entonces es: el riesgo aumenta ahora, con un clima más frío y el aire seco y más personas en los interiores. El virus parece seguir el patrón de otros virus respiratorios como el de la influenza. Por lo tanto, se prevé un aumento durante el otoño con un nuevo pico en enero o febrero. Lo que antes era algo seguro, ahora es algo peligroso. Esperamos que los casos aumenten rápidamente. Este es un periodo extremadamente peligroso y posiblemente el peor periodo de toda la epidemia. Sabemos que usted y todos nosotros estamos cansados del virus, pero lamentablemente el virus no está cansado de nosotros. Tenemos que intensificar las precauciones de seguridad solo un poco más. Estamos considerando restricciones en las actividades para evitar una mayor propagación, pero el día de hoy no anunciaremos ninguna nueva medida. Pero debido a que la propagación ocurre principalmente en entornos privados, el éxito depende principalmente de lo que los residentes de Filadelfia hagan, es decir, que hagan su parte. ¿Qué deben hacer los residentes de Filadelfia? Trabajar desde la casa si es posible, no desde su lugar de trabajo. Mantenerse alejado de los demás, a menos que sea necesario acortar la distancia social. A los padres se les pide que no se reúnan con los niños después de la práctica del fútbol. También que no se reúnan con amigos para ver el fútbol en la televisión. A todos en general, que no vayan al brunch, que no hagan fiestas de cumpleaños ni asistan a ellas. Que por favor se queden en casa tanto como pueda ser posible. Si debe salir, por ejemplo, a hacer ejercicio, les pedimos que se mantengan alejados de los demás. Utilice las máscaras cuando esté cerca de alguien que no sea un miembro de su hogar. Suponga que todos tienen ya la infección. Si los demás no usan máscaras, pídales que lo hagan y suponga que usted también es portador de la infección. Así que, por favor, utilice una mascarilla para proteger a los demás. Las fiestas de temporada están ya a la vuelta de la esquina. Recomendamos celebrar solamente con los miembros de su hogar, es decir, aquellos a quienes está usted expuesto todos los días. Las reuniones familiares extendidas en este momento son algo muy peligroso. Utilice una máscara, una mascarilla, un tapabocas o un cobertor facial. Pídales a los dueños de los negocios que les insistan a sus clientes con que deben de usar la máscara. Esto es obligatorio. Si usted no usa una máscara, se pone en riesgo a sí mismo, a los demás y a su comunidad. Los próximos meses van a ser muy difíciles. Tratemos de evitar infecciones y muertes hasta que la vacuna esté disponible. Si actuamos ahora, salvaremos muchas vidas. Y ahora, las palabras del Dr. William Hyatt para el 10 de noviembre del 2020. Como todos saben, el Distrito Escolar de Filadelfia ha estado trabajando diligentemente para hacer una transición a un modelo de aprendizaje híbrido. Hemos tenido que ser muy flexibles durante estos 8 meses, haciendo todo lo necesario para adaptarnos a las cambiantes condiciones del COVID-19. Como ha señalado el Dr. Farley, nuestra ciudad y los condados circundantes están experimentando picos en los casos y existe la preocupación de que estos números aumenten en las próximas semanas a medida que la gente se reúne para celebrar las fiestas, el clima se vuelve más frío y el aire se torna más seco. Para ayudar a salvaguardar la salud y el bienestar de nuestro personal, estudiantes y comunidades escolares, y tras consultar con el Departamento de Salud Pública de Filadelfia, el Departamento de Educación y el Departamento de Salud de Pensilvania, hemos decidido seguir implementando al 100% la opción de aprendizaje virtual en este momento. Esto significa que nuestro plan para comenzar la transición a un modelo de aprendizaje híbrido el 30 de noviembre se pondrá en espera y todos los estudiantes continuarán participando en el aprendizaje digital hasta nuevo aviso. Por lo tanto, nuestra transición al aprendizaje híbrido se llevará a cabo solo cuando la orientación y los datos que recibamos del Departamento de Salud Pública de Filadelfia, del PDE y el PDH indiquen que podemos hacerlo de manera segura. Hemos recibido una gran cantidad de comentarios que respaldan nuestra transición al aprendizaje híbrido y sé que esta decisión de permanecer 100% virtualmente puede ser una noticia decepcionante para algunos estudiantes y sus familias. Para aquellas familias que querían reanudar el aprendizaje en persona, su selección para elegir el aprendizaje híbrido será respetada cuando se considere seguro para todos hacer esta transición. A medida que continuamos con el aprendizaje al 100% digital, seguiremos comprometidos a apoyar las necesidades de nuestros estudiantes y sus familias. Eso significa que continuaremos ofreciendo soporte técnico y Chromebooks a aquellos estudiantes que aún puedan necesitar dispositivos para participar del aprendizaje digital. También queremos recordarles a todas las familias que aún no tienen acceso a un servicio de Internet confiable que pueden obtener servicio gratuito a través de la iniciativa PHL Connected. Puede llamar al 211 para obtener mayor información. El distrito escolar también continuará proporcionando comidas a aquellos estudiantes que las necesiten, ofreciendo 5 desayunos y almuerzos cada semana en las escuelas de toda la ciudad. Las familias pueden visitar philasd.org para encontrar el sitio de distribución de comidas más cercano a su hogar. Y nosotros continuaremos ofreciendo el apoyo socioemocional diseñado para ayudar a nuestros estudiantes y a sus familias durante estos tiempos sin precedentes a través de nuestra iniciativa Healing Together. Además, continuaremos usando este tiempo para enfocarnos en la preparación de los edificios, asegurándonos de que las escuelas estén listas para recibir a los estudiantes y al personal, y nuevamente cuando se considere seguro el poder hacerlo. Muchas gracias.
Thank you, Armando. We're now going to move to the Q&A portion for members of the media. If you would like to ask a question, please use the raise your hand function, and we will unmute your microphone when you are called on. A reminder that this briefing is on topics related to the COVID-19 pandemic. We are limiting the first round of questions to that topic, including any questions you may have for Dr. Hyatt about the school district's plan that he just announced. As well, if you have questions about the deadline to claim stimulus checks for the CARES Act that the mayor spoke about, for questions on that, we are joined by Mitch Little, who is Executive Director of the Office of Community Empowerment and Opportunity. And as always, we are joined each Tuesday by Managing Director Tumar Alexander. So that's for the first round. If you have questions on other topics, including the election, please hold them for the second round of questions, time permitting. And with us today for questions on the elections is City Solicitor Marcel Pratt. Any questions on the new round of grants just announced by the Office, grant applications, I should say, announced today by the Office of Violence Prevention. We are joined on that topic by the director of that office, Theron Pride. So again, if your hand is raised now and your question is not about COVID-19 or related topics, please lower it and we'll let you know when we get to the second round. Reporters are asked to limit their questions to 3 or fewer. We only have about a half an hour, folks, so let's get to it with Martin Pratt of Philly YBN.
This question is for Dr. Farley. Dr. Farley, has the city started prepping for what vaccination distribution would look like? And if so, are there any lay people, non-medical people that are part of that discussion?
Yeah, we are preparing for that. And the vaccine will probably roll out in several phases where it starts out to people who are at the highest risk for getting it or acquiring to people who may be at very high risk, and then later gradually becoming available to more general population. We do have a very large vaccine advisory committee that has been advising us throughout our planning process. They've been meeting, I believe, weekly for several weeks, and it's very has a diverse representation of lay people, experts of all areas and sectors of society.
Okay, thank you. This next question is, Mike, are we talking about education right now and COVID?
Yes. Please go ahead if you have a question for Dr. Hyatt.
Dr. Hyatt, do you have any numbers of the families that do not have access, estimated numbers of families do not have access to access centers? And also, do you have numbers on families that have taken advantage of the access centers?
We do have numbers of the families that have taken advantage of the access centers. As you know, Martin, the access centers are run through the city, but I think there are approximately 2,700 families who have taken advantage of the access centers.
Okay, thank you very much.
Martin, you good?
Yes.
All right, let's go down to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have 3 questions for Dr. Farley. My first is, are today's case numbers the highest the city has reported for a single day total since the beginning of the pandemic?
Yes.
Okay, and you've mentioned a few times recently that businesses should tell customers to wear masks indoors. Are you seeing any increase of people not wearing masks in businesses just this past week, or evidence of spread in businesses or workplaces?
Well, if you look at the graph we have on our website, it looks like mask use might actually be going down, unfortunately. I'd rather that not be the case, but it doesn't seem to be rising for sure. It's hard to determine how much transmission might be occurring in retail stores because people are in such a short period of time. But I am concerned about the fact that there are clearly plenty of people in these stores not wearing masks.
Okay, and my last question is, are city hospitals prepared to handle another spike that you've just mentioned in January and February? And how have you been communicating with local health systems about preparedness?
I have a regular phone call with the chief medical officers of all the health systems in the city, and they are fully aware that we are experiencing a surge, and they're preparing for that. The hospitals were able to manage 1,000 COVID patients at one time in the spring. And although it was tight for some hospitals, it worked out okay. So we can manage a lot more than we have right now. On the other hand, the number that we're seeing right now is rising very quickly. So we definitely are concerned about this.
Okay, thanks very much.
All right, thank you, Kennedy. Let's go to Kristen Graham of the Inquirer.
Hi, everyone. How are you? So my question is for Dr. Hyatt. I'm wondering, does this announcement move back the rest of the schedule? We know that students with complex needs were supposed to return in January. Ninth graders and career and technical education students were supposed to return in February. If pre-kindergarten through second graders aren't coming back November 30th, are we going to see these kids in school before the spring?
We hope so, Kristen. I mean, we hope to see these children in school before the spring, but it's all going to be based on the advice from the health community and all of the information we're getting from PDE. We could accelerate the return of those other children who were going to be in the second phase, but it's all going to depend on the trends and cases and if, in fact, it's safe to do so.
And obviously this decision was driven by science, by public health conditions, but Dr. Haidt, you said often that we know the pandemic and the challenges it presents disproportionately affect kids of color, low-income families. I mean, could you talk a little bit about what this means for them that, obviously it does pose a hardship for some? I mean, what kind of losses do you imagine we're going to see because students are not going to be have the opportunity to return to school?
Yeah, I mean, our goal was to get children back into some form of in-person learning as quickly as possible. We had prioritized the youngest learners, and then we were prioritizing, as you indicated, children with complex needs, CTE, and because of the disproportionality that exists in terms of who's being impacted by the remote plan, it's one reason why we created PHL Connected. And while the city has stood up and done a wonderful job standing up the access centers, because we're trying to provide those families with additional resources. The most important thing I think that is concerning to me is that we wanted to make sure that children had the appropriate conditions for learning to read, learning to do math, and unfortunately, in many of our communities, those conditions do not exist. And that's one of the reasons we were trying to do our best to get young people back as quickly as possible.
Thanks.
Thank you, Kristen. Let's go now to Pat Loeb of KYW News Radio.
Hi, I know that you guys are loath to discuss cases within the city, but used to say you'd make an exception if it was a public safety issue. So we have reports that like half the sheriff's department is out with COVID-19 and half the 9th district. Can you comment on that?
I'm going to defer that to Tumar Alexander. Tumar, can you handle that?
Or defer it to Marcel after that or before that. I'm not sure what we're allowed to put out there, but Tumar, take a shot.
Afternoon, everyone. Hey, Pat. We had not heard about the sheriff's office situation, but certainly we are experiencing, as we have been since the beginning, we're experiencing employee cases in various departments. So without confirming or denying your specific question, I will just say that many departments have experienced COVID cases throughout this pandemic.
Okay, but it's not a public safety issue at this point.
No, there is. It's not.
And then for Dr. I'm sorry, I'm not sure if this is for Dr. Farley or Dr. Hyatt. I think Dr. Farley, you had said on Thursday that you supported the hybrid plan, and that was just 5 days ago. Can you specify what happened in the last 5 days that changed your mind?
Let me just say that this is the decision ultimately of the school district, but we have been in close communication with the school district and Superintendent Hyatt, and clearly case rates continue to rise. This is a difficult decision, but as a very large school district with a lot of children to deal with, a lot of issues to deal with, we think it's not an unreasonable one.
Okay, thank you very much.
All right, thank you, Pat. Let's go now to Taronda Thomas of 6ABC.
Hi, my question was already answered, so I'm good. Thank you.
Very good. Thank you, Taronda. Let's go to Natasha Brown of CBS 3.
Hi there. This question is for Dr. Hyatt, actually. Dr. Hyatt, we're just wondering, you said that for parents who wanted to initially take advantage or who were going to take advantage of the hybrid learning situation, they'll still have an opportunity to, once you guys decide when it's safe to do that. Can you tell us a little bit more about how many families, how many kids were expected to be a part of this hybrid learning situation?
Yeah, in a pre-K through second grade cohort, there was approximately 32,000 students who were in that cohort. We had 10,000 of those students who were planning to come back or indicated a desire to come back on November 30th. So about a third of the cohort had indicated an intent to return.
Okay. All right. That's all I have. Thank you very much.
Thank you, Natasha. Let's go now to Dale Mezzacappa of Chalkbeat. Dale, you have to unmute yourself.
Okay.
There you go. You're good.
Thank you. Yeah, for Dr. Farley, could you clarify what you said exactly about what you now know about spread in schools that are now open?
So there are approximately 95 schools that we're aware of that have some form of in-person education. That includes parochial schools, charter schools, and independent schools. There's a large number of those that have had cases or clusters of cases, and we have investigated as many of those as we can. And of those, we know of only 3 where it looks like, based on the investigation, the spread occurred within the school. The rest of them, it's maybe cases where they had exposure outside of school, or was just a coincidence, or there were siblings, situations like that.
Okay, thank you. And you said that it was the school district's decision to stay closed. So you did not advise them necessarily that they should not open under the conditions they outlined on November 30th.
I just said we've been in close contact with the school district. It was ultimately their decision, but we're supportive of it.
Okay, and for Dr. Hyatt, just briefly, the access centers, from what I've heard, have been underutilized. Is that true? And why do you think that might be?
I don't know the answer to that question, Dale. We don't run the access centers. They're run by the city. And so I'll have to push that question over to the city. It was my understanding that they were running at about 90% of the individuals who indicated a desire to attend. I may be wrong on those numbers, but that was my understanding.
Thanks a lot.
Mm-hmm. All right. Thank you, Dale. Let's go now to Isabel Sanchez of Telemundo.
Hello, Armando. El Dr. Farley already mentioned something about it, pero me gustaría en español si pudiéramos hablar sobre la preparación de la ciudad en referencia a la distribución de la vacuna una vez llegue, por favor.
Es la pregunta entonces, ¿cuál preparativos tiene la ciudad para la distribución de la vacuna una vez que llegue, correcto?
Right.
Dr. Farley, the question has been addressed already, but for the Spanish-speaking audience, our friend would like to know, what are the city's preparations in terms of distribution of the vaccine once it's with us?
we're preparing to distribute the vaccine initially to people who were either very high risk for serious infection or at high risk to transmit it to those with serious infection, and then gradually increasing from there to be available to the general public. Initially, that first group will probably get it through through medical providers who are and well positioned to provide the vaccination, and then it'll be expanding sites from there.
Por supuesto que tenemos preparaciones para la distribución de la vacuna una vez que llegue aquí. La primera prioridad va a ser para las personas de alto riesgo, especialmente aquellas que puedan infectar a otras personas, y luego se va a expandir al público en general. Inicialmente se va a proporcionar a través de los proveedores de servicios de salud y luego se va a pasar a centros de dispendio específicos para esta vacuna.
Gracias. Thank you so much.
Thank you.
All right, thank you, Isabel. Let's go now to Denise Clay of The Sun.
Good afternoon, everyone. My question's for Dr. Farley. I'm looking at the numbers, and for the first time, or at least the first time that I've noticed, the number of cases in long-term care facilities is under half of the cases that are cases for fatalities. Is there anything that these long-term care facilities are doing right that might be able to translate to for helping stop the spread in younger people?
Well, we've been working very hard with long-term care facilities citywide to try to prevent the kind of rapid spread that we saw in the spring. They're in much better position now than they were in the spring in terms of having personal protective equipment, using personal protective equipment, separating out people who are positive from people who are negative, and various other infection control practices. They are getting support in that from health systems in the city who are funded by the state to do that, because we know they're an extremely vulnerable population. I don't think that level of intense support is something that can be given to the general public. We just don't have the resources for that. But there is a larger message there, and that is that the recommendations we have actually work. You just need to actually follow through on them. If you wear a mask, if you keep your distance, you're not going to be spreading this virus. And what we just did with the nursing homes is make it easier for them to really do that consistently. Across the rest of the city, if people do that consistently, we can beat the virus.
Okay, my next question regards the vaccine. A lot of folks in Philadelphia get their health care from health centers. Are those going to be, included in the first round of vaccine distribution? Will people be able to call their doctor at their health center and say, "Hey, I'd like to get the COVID-19 vaccine"?
The very first round of vaccines is probably going to be for people who are very specialized people. For example, nursing home workers, and those people might be more easily reached in the nursing home where they work. And so that's probably, it's going to be specialized sites where the vaccine is available at first. Over time, we absolutely are talking about the federally qualified health centers as well as private physicians' offices to make it available to just your average person where that person goes for their ordinary vaccines.
Okay, and that's just one last question. You recommended that those of us who were out covering the celebrations and stuff last week quarantine for 14 days, but you're going to have some people who don't necessarily have anywhere they can quarantine, like at home or something. Are the places that were set up for people who needed somewhere to quarantine in the early days of coronavirus still in place? And if not, what can you do to, keep your family from getting sick when you're out doing your job or if you were out in the street?
Yeah, we have a very limited number of hotel rooms which we are using for predominantly people who live in a congregate setting, like a homeless shelter, who are positive so they don't spread the infection to other people in the congregate setting. So most people who are going to quarantine will have to do this at home. And there are ways to do this where you can try to protect your family members by staying off in a separate room with a separate bathroom, using a mask, ideally like a KN95 mask. If you take those precautions, you can greatly reduce the risk of spread to your household members. I should be clear that this is not a recommendation for anybody who happened to be outdoors around the election time. This is a recommendation for people who were really in a crowd of people. And as someone who was walking around during that time, I don't consider myself in that. I'm not sure if you would, but it's not for everybody. It's for people who really were in a crowded situation.
Okay.
All right. Thank you, Denise. Let's go to Jack Tomzik of the Metro.
Yes, hello. This question's for Dr. Farley. Are you recommending, with this news with the School District of Philadelphia, are you recommending that the other school systems that are currently doing some form of in-person shut down?
We're in communication with the other schools in the city quite closely. At the moment, we're not recommending that they shut down for in-person education. Now that may change as the case rates continue to rise, but at the moment, we're not making that recommendation.
Okay. And you talked about considering restrictions. Are you still, would you think about implementing like a widespread shutdown like we had early in the pandemic, or are you still mainly considering targeted approaches, which I think you've addressed a couple weeks ago?
I would say that the full range of options is something that we're considering. These are tough decisions. What we want to do is do the minimum amount of restrictions that would work. We really want to change the trajectory of this epidemic, but we don't want to be so heavy-handed that we unnecessarily restrict things that may be important for people's livelihood. That's a tough decision. We're looking at that right now, but the full range of options is something we're considering.
Okay, thank you.
Thank you, Jack. Let's go to Laura McChrystal of the Inquirer.
Hi, I first have a question for Dr. Farley. You mentioned you're seeing spread in restaurants. Can you clarify, like, are these is this indoor dining, and are they restaurants where people are not following the city's rules, or is it in places where the rules for indoor dining are being followed?
It is indoor dining we're hearing about, and it's hard for us to tell for sure how much people are following the rules. We know of a large number of people in a restaurant, and you may think, well, maybe that's larger than it should have been given the limits they're supposed to be following. So we can't say for sure, but it does appear to be indoor dining related.
Okay, and as hospitalizations are increasing, my next question is there any consideration of setting up a field hospital such as we had at Temple in the spring?
At the moment, we're not making preparation for such a hospital. The hospitals do have quite ability to add beds through their various surge plans, and we also do have the COVID relief unit. It's a unit for nursing home level patients. And so the hospitals can empty out some of their beds into that facility, which can then free up beds for patients who may have more acute illnesses. And we're hopeful now that would be able to cover the bed needs, but we're going to watch this very closely and we'll do whatever we need to do to try to accommodate the people who need hospitalization. But this is definitely among the things that are weighing on us as we are considering whether we need to do restrictions. We need to be able to protect our hospitals so that they're there when people need them.
Okay, and to clarify that the COVID relief unit could potentially be used if hospitals needed to offload patients who are not nursing home residents?
No, it's really for nursing home level care.
Okay.
These are not, a COVID relief unit is not a hospital. But we learned in the spring wave that there were a number of people who had COVID, who had nursing home level care, who couldn't safely be transferred back to a nursing home because they were still infectious. And so we didn't have any place to put them, so they took up a hospital bed. So now they can go to this unit and free up that hospital bed for someone who may have a more acute illness.
Okay, thank you.
Thank you, Laura. We're going to go to Alan Yu of WHYY, and that will bring us to the close of the first round. We have just a few minutes left after Alan for questions on other topics. But for now, Alan, you're up.
Hi, questions for Dr. Farley. First of all, I'm wondering about the preparations for a COVID-19 vaccine. Do we know how prepared the city or the medical facilities are to meet the storage or temperature requirements for such a vaccine, since some of them do require ultra cold temperatures?
Yeah, we've been working closely with them about having a mechanism to make this work so that the Pfizer vaccine does need to be stored at minus 70 degrees. That's very, very cold. The city has the ability to store vaccines, a number of hospitals, vaccines at that temperature, and a number of hospitals in the city have the ability to store vaccines at that temperature. We think that that's enough, that then we can distribute the vaccines from there. There is some period of time after which you can remove the vaccine from that temperature and still vaccinate people. So we're working through all those details, but we think that it'll work out okay, at least for the first batch of vaccines and people to be vaccinated.
Okay, thank you. My other question is, when you refer to a rapid test that is coming to the city, is this the Avid Binax Now COVID-19 test that uses a test card?
Yeah, the Avid Binax Now test cards are the cards that are coming to the health department, and we will be distributing to testing sites across the city. Now, there are other rapid test platforms available that require a machine. Those are already out there, but what's new is these cards.
Okay, thank you. And my last question is quickly, if you could talk a little bit more. I know you talked about how you expect there to be, like the models predicting increase in the number of deaths later on. Can you talk a bit more about, we have any idea of like when that could happen and, why you think that would happen in the future or near future?
Well, the other respiratory viruses like influenza tend to rise in incidence through the fall and peak in January or February. It appears that COVID is following that same pattern. So we can take our case counts now and you project out that to increase between now and January and February, and you figure that a certain fraction of those people are going to die. You can project out how many deaths we're going to have, and that deaths would similarly likely peak in January or February.
Okay, that's it. Thank you.
Thank you, Alan. Let's go now to Kennedy Rose. Let's go back to Kennedy of the Philadelphia Business Journal.
Hi, I have a question for the mayor. Mayor Kenney, I was wondering, how do you feel seeing these case numbers increase so dramatically, and what message do you have for Philadelphians?
Wear your mask and stay away from each other and do the things that the health department is suggesting that you do. I know when people get kind of fed up with restrictions, they start to rebel a little bit. I think these numbers will throw some cautionary information into the mix, so people will say, "Yeah, this is still for real, and we need to pull that mask up tight. We need to stay indoors as much as we can." I mean, and that's all. They're not really difficult things to do. I mean, I know they're annoying things to do, but they're really not hard things to do. So if we do that, we'll get out of this quicker and get back to some semblance of normal life.
Okay, and my last question is, I think it would be for Tumor Alexander. I was wondering, are there any plans for another marketing campaign to sort of reinvigorate the city's stance on mask wearing and social distancing?
I can jump in on that.
Hey, Kennedy. Yeah, I was going to suggest that Dr. Farley take that.
Okay.
The mask campaign that you've seen, we have re-upped, if that's the right word. And so you will continue to see messages, with slight variations, that are similar to the message you've seen before, like the one behind me, just showing people what they need to do and why they need to do it.
Okay, thank you.
All right. Thank you, Kennedy. And finally today, let's go back to Pat Loeb of KYW News Radio.
Hi, I don't know if this is for the mayor or Tumar, but the homicide rate is at a 25-year high, and I know you got a late start on focused deterrence, but how do you think it's working?
Well, I mean, this is very frustrating because we're in the midst of all these other crises along with the homicide and shooting crises. Yes, it's a number that really bothers me when I see it every day. And we're doing our best to get, we were just coming out of another round of civil unrest, which puts our police in a different situation to be assigned to various places that are not as intensive when it comes to trying to keep people from shooting each other and killing each other. So yeah, it is frustrating. We'll hopefully, with this election over, with the encampment gone, with the civil unrest seemingly calm, with the numbers, the COVID numbers going up, we're going to do our best to get it down. That's all about. I don't know what the future brings, so I can't give you a definitive answer.
Hey, Pat, and then just to add, certainly we've had to stand up the focused deterrence, as you called it, or GVI, during this pandemic, but we've been working with the Office of Violence Prevention and other partners to sort of do custom notifications in the Southwest Police Division, and from all intents and purposes, what I've been told is that's been going well. We've been planning to sort of spread that out and take that, spread out the GVI and take it to other parts of the city in expansion. So certainly we're trying, certainly we can't do things similar to what we could do pre-COVID, but we've been adjusting and been sort of trying to work effortlessly to just push out this message and make sure that program is up and running, and certainly the young people who we've encountered as a part of that program, making sure we want to push out some of those social service needs that they require, and also when needed, the enforcement mechanisms that's also a part of the program.
And Tumar, we have Theron Pride of the Office of Violence Prevention on the line. Theron, I didn't know if you wanted to add anything to the mayor's and Tumar's comments.
No, I will just definitely reiterate what the mayor and Tumar said in terms of—
Can you turn your camera on, Theron? There you go. Oh. Go ahead.
I would definitely reiterate what the mayor and Tumar said. We are obviously working with and working through a number of crises, but the GVI, the Group Violence Intervention, is moving forward. We are trying to reach as many people as we can, literally at this point going door to door with this message, asking individuals not only to put their guns down, but to take up the offer of help that's extended. We've had over 100 number of individuals at this point reached out and contacted. So we know that this is going to be a slower process because of the pandemic, because we have to go door to door. We can't bring people in large groups and deliver the message, but we are seeing individuals who receive this message, not all of them, but we do see a number of them still reaching out, accepting the help, and we're working to connect them. And as Tumar said, I think we're hopeful that we continue to hear from our partners in law enforcement that among some groups and among some individuals, there are some tensions that seem to calm for a period. And so that's promising. We want to see something more. We want to see this build. But we got to recognize that within this pandemic, we obviously have a huge challenge to overcome, but we're going to keep pushing forward.
Thank you all very much.
Hey, Pat, and just to add, Theron and OVP folks pushed out another round of targeted community investment grants for the boots on the ground folks. So certainly that grant is open now and available for community groups and organizations to apply. I believe this is our third round, Theron?
That's right.
Our third round of grants that we're pushing out.
Thank you.
All right. Thank you, Pat. And finally, let's go to Mark for what he promises will be a super quick question.
Tumar kind of answered some of it. Is there a website and a link that the community can go to, or community outreach organizations that will list the grants and the application process?
Yeah, I'll let Theron come back on and answer that. Thank you, Mark.
So yes, in the application that is now available online that was pushed out with the press release, people can log on, they can receive the information regarding the grant, and once those determinations are made, of course, we will again publicize, it's like we did the last round, by way of a press release so people can see who those grantees are. And we hope to use our website as we further build it out so that people can see that for months to come in terms of who those grantees are and where those services are operating. It's just something under development as we go into this third round. We're excited about being able to show more of that information because we do believe that the investment in these grassroots efforts collectively with all that we're doing can help make a difference.
What's the website address, Theron?
So right now, we just, through the press release, you just have to click on the link. There's not a direct website right now. People can reach out to ovpinfo@phila.gov, ovpinfo@phila.gov. If folks have specific questions or have trouble accessing the link that's available through the press release, we can get them connected. So ovpinfo@phila.gov, they can reach out, we can get them connected to that. But as we move forward with the Office of Violence Prevention web page, we will also try to post more of that information and make that available for people once those determinations are made for this third round.
Got it. Thanks.
All right. Great. Thank you, Theron, and thank you, Martin. That concludes our briefing. Tomorrow is a city holiday, Veterans Day, but we will still issue a COVID update by press release, as well as the remainder of the week. Our next briefing at this point will be next Tuesday on November 17th at 1 p.m. But obviously, if circumstances change, we would announce a possible avail in advance of that. Thank you.